All right, thank you to all of our panel members. I want to open the floor up for questions. So do we have any questions? Yes, right here.
Can you talk a little bit about the mental health screening process at MEPS or through recruiting? I think this is probably best for you.
Sure. If you want more detailed information, I can certainly get that. I can give you a card, but I know that there is basic general mental health screening that is done through MEPS in recruiting. But that is not my expert area. So if that's something that you would like, I'm more than happy to sit down and talk with you and also our mental health individuals.
I think the question that you might be asking, or the question under the question, so you tell me, is what pre-existing vulnerabilities are service members coming to the table with before they even join the military that might then be impacting them across the lifespan of their career and then into their veteran status, which I know Dr. Walsh quite well, and I know he does know that about the ACE pre-existing vulnerabilities.
Yeah, so if they have certainly a chronic mental illness, certainly things like chronic depression, there's an accession process where they're not allowed into the military. So that's a standardized process, if that's what you're asking. Yes.
Is there another question over here? Yes.
Hi, I was wondering if any of the organizations that have spoken today are involved in any consumer research or survivor research where suicide attempt survivors are able to be involved in the design of the research and development of suicide prevention programs.
So at SAMHSA and our suicide prevention programs, we have tried to incorporate this in a number of different ways. We've tried to highlight the stories of hope and recovery of people who have experienced suicidal thoughts or have survived suicide attempts. We make this a requirement in many of our grants that the voices of people with lived experience are included in the efforts. So those are some of the ways that at SAMHSA we have tried to promote that. And it's a particularly important area because for many years the suicide prevention field was really not paying systematic attention to the experiences because we can't talk to those who have already died by suicide. Of course we can talk to their families and we should talk to their families. But having people share with us not only led them to be suicidal, but what helped them survive, what helped them get through that is vitally important. And there's some evidence that those messages of hope and recovery can have a positive impact as far as suicide in the general community.
One thing I can add is on a frequent basis we work with individuals who have experienced a loss of suicide, so family members. So at least twice a year we are involved in the Tragedy Assistant Program seminar, and we actually we go to those individuals who have survived a suicide attempt or those individuals who have had service members who've died by suicide, and we get their direct feedback, especially around postvention and how we're handling suicide deaths and whether or not we're taking the right actions and what can we do better. We had a research study about a year ago where we did many interviews and research on do we handle military service member suicides in the proper way. And many of those individuals who gave us feedback were involved in the Tragedy Assistant Program seminars that we participated in. So we get that direct feedback and it's been very invaluable.
Any other questions? Yes, right there.
I was just wondering if there's any numbers out there that sort of go over vets that have gone back to school versus vets that have come out of the military and have not gone to a university. If there's any sort of numbers like that.
I don't have any data on that, but it's definitely a good question. One thing I do know is in the literature it speaks to the importance of education as a protective factor. So those that have increased education and their life by suicide less than those that don't, so it is a protect factor. Otherwise, I know, if you heard me talk about the data on 18 to 34-year-olds, we do have a strategy right now where we're trying to meet with veterans or get after this issue where they live and thrive, and we believe that is in the university sector, particularly in community colleges, so we're trying to build our partnerships in that space so that we could have that be like a force multiplier for our programming. But I don't have exact data. Hopefully that helps.
If I could, I'll just mention
Yeah.
two things quickly. One is on our campus suicide prevention program. We do pay particular attention to the needs of veterans who are returning to campus there. So that's one thing. The other is that I think the role of education as a protective factor in suicide prevention, probably the most systematic work has been done by the Princeton economists Case and Deaton, who have talked about the deaths of despair, and their work shows that there's that the rates are really different when you look at college educated and above versus high school educated and below. We need to understand better why that is, but that's an important piece of work to be aware of.
Another question? Yes.
I run a father's rights crisis line where I answer calls, and a wounded combat veteran told me that being injured in combat wasn't as bad as the pain he felt in parent alienation when a spouse uses the children against him in court. I was wondering if you had any experiences, and I know of a father who's a Navy veteran, 20-year Navy veteran. He twice attempted suicide, highly decorated, top secret, etc. Do you have data on the interplay between divorce or men going through divorce or going through a toxic divorce and suicide? That's my question.
Yeah, there's been quite a number of researchers that have studied this issue, both on the active duty line of work and just in society, and relationships are an important risk factor, absolutely, and it's not always marital, it could be in any manner of interpersonal relationships. That is something that you see in a lot of our suicide deaths. Reference my colleagues talk about the importance of autopsies and fatality reviews. When we study our deaths after the fact, we see that there were deterioration of relationships with significant others, and it was chronic, like it existed over time. So it is absolutely a risk factor. I don't know specifically about the child piece. I've spent some time myself studying parental absence and how that impacts children over time and their own emotional well-being and development. So for example, when parents are in and out of that parenting role, usually because of job requirements, not because of a nasty divorce, but disrupted parent-child relationships over time are problematic, and there is research on that, yeah.
Thank you.
I'll just add that in some of our death reviews of active duty suicides, we know that there's been a failed relationship or a very stressful relationship discord about 7 days before an individual dies by suicide, and that seems to be a recurrent pattern that we see in some of those deaths.
I'm reminded too of just a study from some analysis from the Marine Corps where, if you remember this work, Adam, the parents that were separated from their children, and that being a risk factor when they were still the primary parent, but they chose to stay in one state, and the family stayed in one state and the parent moved on, and that being a higher risk.
Yes, yeah.
Do you remember that?
There was some work
Can't
that
remember
was
the particulars.
done out of Penn State University that showed some of that marital and parent discord. It showed if there was, if one of the service member didn't have access to a child or frequent visitation, they showed that there was an increase in suicide risk.
Thank you.
I couldn't remember the particulars, but I knew you would.
One more quick question?
Yeah, so I remember seeing a statistic that 50% of the suicide rates did not have a diagnosable mental illness. Can you explain why is that, and like how do you go about reaching out to those people?
Well, in terms of the number, you're probably referring to the CDC report. It's based on data from the National Violent Death Reporting System. So it was 50% having a known mental health problem there. So, but two things to be aware of. One is that that did not include substance abuse. So if you add substance abuse, that number goes higher. It also did not include undiagnosed mental health concerns. So that's just one thing to be aware of. But certainly a huge issue is people who have not sought help, as Adam, talked about. How to encourage help seeking when somebody's thinking about suicide is usually important. So I don't know if either of my colleagues wanted to talk about outreach in that situation.
Well, I would just add that, yeah, in the DoD, very consistently, we've seen in the numbers that only about 50% have a mental illness. And I would say that that's actually consistent around the world. Many other countries, from Malaysia to India to China to many other countries, they don't show those higher rates of mental illness and suicide. So I would say that I would explain that by saying that there's a lot more going on than mental health. Mental health symptoms can increase risk for suicide, but the environment, access to lethal means, is a very strong predictor of suicide. So having immediate access to a lethal means of suicide, because as we know, suicide can be impulsive. So that's another thing that is going on in addition to mental health. So that mental health is one part, but certainly not the whole picture.
Great, well, let's give another round of applause to all our panelists. They're going to be around if anyone has any other questions. Thank you all for joining us. Please go back to your offices and let your bosses know about the Congressional Men's Health Caucus. Men's Health Network, our team will be going out and doing new member meetings in the next couple months. So letting all the new members and their staffers know about what the caucus is. If anyone is interested, please contact Markwayne Mullin's office, Taylor Hiddle in that office, and then Congressman Payne Jr.'s office, we have Stephen Schultz there. So please let them know if your boss is interested. Thank you. Have a wonderful day.